Today, there's a global celebration going on to mark the World Tobacco Day. Of course, the day is set aside to reduce tobacco use around the world. Ghana is participating in these celebrations as has been done all over the years. Now, it's on the theme that we need food, not tobacco, and it is a source of some number of issues and a series of illnesses for many, including lung cancer, heart diseases, stroke, and a lot of respiratory diseases as well. A study conducted by the NGO Vision for Alternative Development indicates that as many as 804,000 Ghanaians smoke cigarettes every day in 2015. Executive Director for that association and the National Coordinator for the Ghana Non-Communicable Diseases Alliance, Labram Musah, will be joining us shortly. But just take a listen to some of the views on the streets of Accra about this whole issue relating to the use of tobacco.
Escalates. That's why I'm saying that, you see, the right for the box that smokers die young. So as for me, they should ban cigarettes. I know plenty people, they smoke cigarettes, but as for me, it's not good, so they should ban.
I think people shouldn't allow to smoke publicly because those who inhale are also affected.
It's not good. It's not good for our health.
Why not?
Because even it is written on the cigarette box that it can cause harm to your health. So I advise my colleagues out there not to engage themselves in it. Okay.
Some views there on the issue of tobacco use. But as we celebrate the day, obviously the theme is that we need food, not tobacco. Labram Musah is here with us. Thank you, sir, for your time. The theme itself speaks volumes, but many will say tobacco is addictive. So those who are using it may not see the essence of exactly what you're talking about.
Well, it's not entirely true, but let me greet your listeners, right, and, or your viewers as well. Mm-hmm. And in fact, I must say I agree with the guy who was speaking. I mean, the point is this: there are many advocates who have advocated for that a product that has no benefit. Yeah. I mean, whatsoever, whichever way you look at it, I mean, it should be banned. I mean, entirely from the world. But unfortunately, that has not been the case because many are citing issues of smuggling and the fact that once something is banned, control is very difficult. So we need to put measures to ensure that people willingly, are able to stop, So the point is the issue of the nicotine, the industry themselves, I mean, the manufacturer themselves knows that is the evil, the intent within the tobacco product. So they, after producing the product, they then inject, the nicotine inside, just so people are unable to stop smoking. Because they know that when there's nicotine, then once you smoke, then you are hooked to it. And that is the notion. So once nicotine is reduced or is taken from tobacco, the tobacco product itself, then automatically you have people, having their way through without having to smoke. So every manufacturer finds a way, to inject, or makes the product more appealing to people.
But I've not, tried smoking, or I'm not a chain smoker, so I'm not able to tell the ingredients and how the feeling will be. But without nicotine, what is research telling us about that feeling of it when you don't have that element in it?
Tobacco contains about 7,000 chemicals. 7,000. And most of them, about 59% of them are cancer-causing agents. So for us as civil society organization or advocates, or even public health advocates, we don't seem to recognize the any benefit that whatsoever that there is when it comes to tobacco. But of course, people who smoke will tell you that it gives them some kind of feeling, some kind of appetizer, But of course, all of these are just, worldly things, that, and of course, nobody will willingly go and smoke. People who smoke will tell you that it is as a result of either peer pressure or results of some activities of the tobacco industry, like advertisement, the cost of the product, which is very cheap in the market, and the availability. So it makes people, easy to access it. And once you see your stars, movie actors, singers, then people tend to emulate, that kind of behavior. And the industry have used, and used that to actually ride on and getting more of the youth to smoke.
So what sort of reforms are we on the lookout for now? And by extension, your group, your alliance, what would you want to see in terms of the concrete changes?
Right. You know, I was here some few months ago talking about the fact that one of the measures that government all over the world are putting in place has to do with, you know, taxing this unhealthy commodity, especially tobacco products. And indeed, I'm happy that at least Parliament was able to pass the excise duty the bill. So currently, we are going to see some, you know, level of rise in terms of taxation, you know, on tobacco products, which means the product is going to be a bit high, which, you know, prevent the poor, young people and children from getting access. And then also, you know, today's World Tobacco Day, we are raising awareness. We are calling on government to, as much as they can, government all over the world, as much as they can, to, you know, to activate the sections of the Female Convention Tobacco Control, the WHO Female Convention, that actually, you know, specify or giving direction to many governments on how they should, you know, try to support farmers.
And in that directive, are we losing sight of some key factors?
No, in fact, I must say that in Ghana, we have made some progress, but the progress, starts from the fact that, you know, we don't grow tobacco in a country anymore since 1996, we stopped growing tobacco. So that have made, you know, the growers, you know, to reduce. So, but as of 2015, we're having about 500, almost about 600 farmers, growers in the country. Unfortunately, however, government and all of us, we've not prioritized the alternative livelihood stuff, where we want to see how we can support farmers to shift from the growing of, you know, this product like tobacco, which has no benefit, as I mentioned to you earlier, to the growing of, you know, other sustainable, you know, food crops that will sustain us and sustain the economy. I can tell you that so much hectares of land, is used for the production of tobacco products. If you're able to channel all this land to the production of good food, I don't think we will have problems. So that's why we are calling on our authorities, especially the NAPCO, you know, that, and is the food, something, I've forgotten the term, that the government is currently, you know, implementing.
Planting for food.
Yes, so that if they can also look at, because there are farmers in Ghana who are still producing tobacco products, and when they produce the leaves, they transport them to other countries for the purpose of, you know, like Nigeria and that stuff, for the purpose of growing this tobacco. So the point for us is we want government to channel its energy there and invite or bring, the program on board, and let's see how we can support those farmers to shift from the production of, you know, tobacco growing, because it also has its own effect in terms of, working around it. You know, it has some diseases that the farmers themselves go through. Children are poor because, you have to work on the farm instead of going to school. You know, it comes with so many challenges. And then also, it doesn't fetch, you know. But the point is this, many farmers complain that they don't have any alternative. That is why in the minds of framers of the Framework Convention Tobacco Control, WHO, they came up with guidelines on how government should be able, and there are so many support programs, even globally. WHO has programs that they can support government. Unfortunately, Ghana have not taken advantage of it. So as we mark the World Tobacco Day, we are calling on government to activate that session and then see how we can collaboratively work together to support our farmers. And this will go a long way to reduce, you know, the menace and then the disease that you mentioned earlier, cancer, the cardiovascular diseases, hypertension and stuff that we are faced with. When it comes
so how is it that in spite of, toughened policies, we're not able to control this tobacco use?
Well, so you see, like I said, it's a legal product. The tobacco industry also have, you know, and for their lobbies. You imagine what happened in Parliament before we passed the excise duty bill, for instance. For me, I was disappointed that we have to go through voting for us to get a public health, aspect of our, you know, and the argument has been that this will protect our children from getting, you know, addicted to tobacco use and stuff. And we have to go through voting. This tells us that there are lobby groups. There are the tobacco industry themselves are lobbying. They are doing their own advocacy. We even have civil society organizations who front for the tobacco industry. As I speak to you, I will not be surprised if we also have counter, you know, civil society groups who are also promoting, you know, other aspects of tobacco products. And this is not good for, you know, for us. So the point is this, I know government is trying its best, but indeed the industry will not sleep. They will also find means and ways of reducing the extent to which government will put, you know, tough or stringent measures to reduce the, you know, the effectiveness of tobacco control. Currently, we have a law in Ghana, but the effectiveness has become not so much in terms of implementation.
And while you make the effort at tackling or controlling and possibly minimizing the use of tobacco, there are those who are still living with the complications of it, of its use, addiction, and all forms of complication. Are you mindful of these sects of people who are still reeling under the effects of tobacco use?
Indeed, let me say that even came out during the national commemoration where the Ministry of Health was tasked to ensure that at least they support, the district hospitals, the psychiatric hospital, and hospitals have been dedicated to support people who are suffering from addictive substances, for instance, tobacco use. So, for instance, Ghana passed a cessation guideline in 2017, for instance, that has also not seen much of implementation. But the point is that there are, facilities within various hospitals where people can be taken.
But is it that high? I mean, just to make a case for why you're pushing for this no tobacco day?
What you mean? Whether there's a case?
Yes, precisely.
No, indeed there's a case because the GRO will tell you that Ghana still imports millions of cigarette products in the country, and we get it consumed. So, and government is also getting much revenue. So it tells you what they call it. The problem that we are facing currently, and we are told by some doctors that every Friday, if you see the cases that go to the hospital in terms of hypertension, in terms of stroke, and most of these conditions that go to the hospital are as a result of these unhealthy commodities. And tobacco is number one. Because people are now abusing the product. It's very cheap in the market. You go to the market now, if you have 50 pesos, you can buy a stick of cigarette to smoke. And now, shisha. Shisha has not taken all over, our youth. And that is the most dangerous, aspect of it. But because shisha has not been there for a long time, we are not seeing that the real effect. But trust me, we are calling for government to ban this product, including electronic cigarettes, that our youths are becoming so much obsessed with. And this is as a result of, advertisement. Advertisement on TV, radio has been banned. But unfortunately, social media is where it is. And then one other thing is that our celebrities are also not helping the case. You see most celebrities who are also smoking in public, are also using shisha in public. So the point is that what you tell your teaming youth, supporters who are following you, definitely they would want to emulate what their role models are doing. So we're also calling on, on these celebrities to be mindful of the fact that for you have the money. If you get the cancers, the whatever, you can fly and get treatment. What happens to your teaming youth? Who are not?
But there's also the commercial implication of this, a reason for which what you're looking for in the form of an outright ban may not come anytime soon.
Well, so the discussion has not begun. We call it the end game.
Yes.
In fact, we don't see it to come very soon, but we are actually...
It's unlikely that it may even come.
But no, it would eventually get there.
Are you certain?
Yeah, we are very certain that to get there because a more awareness creation is being created. Because even the tobacco industry, they are moving away from the traditional cigarettes, like I told you, to more innovative stuff. And they call something harm reduction. But the point is that we're not talking about harm. We want a tobacco-free society, a tobacco-free world, so that we can all live happily, devoid of these diseases. So indeed, yes, for the end game, the conversation is now going on, but we want more stiffer, regulations, laws. But the point is that our policymakers, our government should stand firm and resolute, and don't listen to the industry. Because, like I mentioned earlier, a product that does not have any benefits, we don't have to entertain, such an entity at all, whether commercial or whatever, because they only look out for their interests and not the interests of me and you, our children, and every other person.
For some, you're simply attacking the product itself when you could go after persons, approach the issue with some level of moral suasion, trying to appeal to these group of persons who are going for tobacco, not to use them.
Okay, so you see, the Framework Convention on Tobacco Control, has given, in fact, it touched on every aspect. So there's a target for the industry, where we are calling on the industry, exposing them of the fact that they claim the product is unwholesome. Yes. They claim, even they themselves have promised that they are going to stop the production of tobacco. But in the time we are getting closer, they shift the goalposts. So the point that they themselves have admitted that the product is very harmful and very deadly to our health. That's why they're coming out with other, alternatives. But even those are even more dangerous than the tobacco itself. And the fact that the smokers or awareness creation is also ongoing on radio, on TV, raising awareness of the youth. And that is why I always say it's a concerted effort. Civil society, government, clinicians cannot do it all alone. We need the media. We need our celebrities to support a healthy cause. I'm looking for a celebrity who will come and say, okay, fine, I am here and I'm now going to support the cause, to stop, our youth from smoking. But like I said, you rather find them rather smoking, in public, glare. So if this happens, it will be difficult to reach, our goal of, So the point is that we are targeting the industry. We are also ensuring that we are monitoring government reactions, government action, just as we saw during the, and the passage of the excise tax on tobacco, for instance. The whole world have seen, what our policymakers are looking out for instead of public health gain. So the point is this, yes, so there's naming and shaming, which mostly civil society will do. We expose government, we expose the industry for unethical behavior. We also expose our own civil society organizations who, for whatever reason, support, tobacco industry and their products.
What's the way forward? The next set of activities we should be expecting from your coalition, just to drum home the points that you've been making all these years? Right.
So you see, public awareness is very key in whatever that we're doing. Unfortunately, because of the ban on drumming, and we're not able to have that kind of mass this thing. But together with FDA and civil society, we are planning to do, as I speak to you now, the commemoration is also done in other regions. So all the regional capitals are also commemorating the World on Tobacco Day. It's a form of raising awareness. So we have a program where, throughout the year, it's going to be awareness creation, engaging people, engaging students. Indeed, today we had a quiz competition, where students were involved. Just to continue to raise awareness, give them understanding of the harm of this product and how practically we can, together with them, reduce the menace of tobacco.
How about the appeal that you jointly combat this menace? And the fact that you have the youth also resorting to other forms of addiction, which is also drug use, by the way, aside tobacco. And the feeling is, once you push them off tobacco, they may be moving to the alternative ones.
Well, so it's unfortunate.
That's of a concern to you as well.
Yeah, indeed, it's a concern. That is why, when the excise duty bill was passed, for instance, it's included taxing, electronic cigarettes. And in normal circumstances, electronic cigarettes are supposed to be used for cessation purposes, so that in the event that somebody, want to stop smoking, the clinician or the doctor will prescribe. It's a prescriptive medicine, right? But now that it has been, given the fact that GRA can now begin to tax, then the industry will now have the opportunity to
bring it.
So we are even calling for amendment of that particular aspect, just so we can have is electronic cigarette, the new product that I'm talking about, to still be, be used as, as cessation instead of for recreational purposes, right? So the point is, it's a big challenge for us. Shisha has come. There's no much regulation of operation. Many countries have banned shisha. But the point for us really is, it all boils down to our policymakers. When our policymakers begin to understand that this is a disease that has befallen the world, and Ghana, as many countries are putting so many measures, and they are reducing the prevalence of smoking. Though smoking is not very high, but it's growing gradually. So the point for us is, there are many countries that are doing very well. They are reducing the prevalence. Rwanda, Kenya, they have all banned shisha because they are seeing an epidemic before them. Why can't we do the same?
Labram, we need to go, but let's not leave without talking about public smoking. It's also a form of the challenge, because yes, I may decide not to use the product, but someone else's decision to use it could affect me in public.
Right, so thank you very much. Indeed, I'm very happy about this. Let me use the opportunity to say that we have a Public Health Act, and then Part 6 is the tobacco control measures. And it also has a provision that states that tobacco smoking, public smoking of tobacco is banned. So the point is that smoking is banned in Ghana. I'm talking about public smoking.
Oh, really?
Yeah, it's banned in Ghana. You can't smoke in public.
Yes.
You can only smoke in a DSC or DSC, which is called designated smoking room.
Okay, so there should be a spot, there should be an area where you can do it.
And this law was passed in 2012.
And yet?
So that's the thing. I'm not sure if you are aware, or even your listeners are aware that smoking is banned in Ghana. So anybody who smokes with system of smoking, he has violated the laws of Ghana. But the point is this: if, for instance, your studio, for instance, there's a smoker who wants to smoke, it is incumbent on the management, to then, come out with a structure where the person can go and smoke, so that at least it doesn't affect me and you who have decided not to smoke. Because
certainly not close to the newsroom.
Definitely not close to the newsroom, not to the newsroom. And the point is, I see, even when the law was being done, we told government, I see, there's no way you can keep smoke intact. Smoke cannot be. There's no mechanism that can keep smoke. Smoking will definitely come. That's why when you go to some facilities in the country, for instance, there are many facilities that have the necessary smoking room. I don't want to mention the hotels, but the point is this: they have smoking rooms, but they are violating the rule because they're not able to. Once you open the door, the smoke come inside. You understand? So you are still affecting people who wish to sit.
And inhaling that, according to research, is even more dangerous than actual smoking.
Well, so you see, so I will not dispute that because once you puff it out, there's a chemical that it comes in contact before you inhale it. But the point really for us is tobacco kills 8 million people annually, where secondhand smoking also kills about 600,000 people annually. So the point is that whether you are
also a significant figure.
It's a significant distance. That's why we call it on parent especially, because the law did not go into the homes of people. Fine, there's ban of smoking in public places. So the argument is, is my home a public place? If a husband decides to smoke, and there's a woman, there are children, what becomes of that? Then it becomes like domestic violence bill. The point is that the woman can or the man can choose to report the husband or whoever of smoking, but the point is that will you be able to stand the repercussion or let's say imprisonment or finding your husband? So then it becomes, so the point is it's about creating awareness, getting children to understand, also talk to their parents that indeed this is a nuisance to me because as you smoke, you are affecting your child, even the unborn baby, if your wife is pregnant.
Labram, we need to have this conversation once more, but certainly we've run out of time. Thank you for spending some time with us here on
Thank
the
you very much for having me.
And I wish you the very best, hoping that you'll be able to get government to do their needful.